Well, I think the Health and Social Care Bill is introducing some changes into the way that the commissioning and other structures work in the health service. I'm on the record many times as saying that I think it's the less important of the two challenges facing the health service, the more important being how you change not the management structure but healthcare, and change healthcare in a way that reflects the needs more accurately of today's and tomorrow's patients. One of the problems of our health and social care system is that they've grown up as historical institutions. They reflect the needs of a previous generation of patients, if we're not very careful, and they reflect some of the abilities of previous generations, whereas what we need to be doing is delivering services that use today's technology to meet the needs of today's and tomorrow's patients. And that implies a major change in the way care is delivered. And that's by far the more important challenge, in my mind, facing the National Health Service and indeed the social care system at the moment. I think that step one of this process is that we have now for over 20 years recognised the importance of having commissioning as a separate activity from delivering the service. Now, if you establish the commissioner separately, the commissioner has the power to change service in a way that makes service much more integrated. And the first challenge, I think, is to ensure that we have single commissioners, because until we've got single commissioners, I don't think we'll have a single system of service delivery. So one of the things I've been talking about today is the importance of, in each locality, people finding ways of integrating the commissioning process so that the integrated single commissioner can then commission services which are experienced by the patient as a single service, not multiple services delivered by multiple silos. There are several different agendas that all have to be brought together here, and one of the agendas is the need to change the way clinical care is delivered, medical care, but also nursing care and other non-medical care, to change the way it's delivered in a way that reflects the needs of today's patients and current best practice as it's experienced not just in this country but other countries in the world as well. And that process of change of the clinical model needs to take the clinical community with it. Indeed, it needs to be owned by the clinical community, which is why I think we've been trying for 20 years to drive change into the system without successfully engaging the clinicians. In various parts of the system we've tried, in various parts of the system we've on occasion succeeded, but it hasn't been a system-wide success. And I think one of the bits of value added that comes out of this bill needs to be a much fuller engagement, not just of GPs, but of the whole clinical community in the commissioning process. One of the sadnesses of this legislative process is that we seem to have got ourselves into re-debating all the issues that were debated when Alan Milburn put through a piece of legislation in the early part of the last decade and Ken Clarke put forward a piece of legislation at the beginning of the 1990s. And in truth, there isn't a great discontinuity between these, or the two acts and this bill. It's a consistent direction of travel. I think that many of the arguments that are actually presented by both sides of the argument are grossly overplayed. I've described it in the House of Commons as industrial quantities of nonsense. And this bill actually achieves some relatively modest, but in themselves quite welcome steps forward. I think the changes on public health, although they've raised concerns in the public health community, do take that a step forward. I think the opportunity for greater clinical engagement is welcome, and I think the emphasis the bill places on greater engagement between the NHS and local authorities is also welcome. So it's a step forward, but it's not a great discontinuity. I think there's always a danger that rules are felt sometimes to stifle innovation and make innovation more difficult. That's and in a sense, it's the nature of the beast. What we have to do is to ensure that that happens as little as possible. And I think dialogue of the kind that we've seen today in the Healthcare Forum, dialogue between the health service and its private sector partners, and within the health service itself, of course, because it's a vast community in itself. Dialogue to understand what the opportunities are can only open doors And we need to ensure that those doors are fully open, because our need to understand and take advantage of all those opportunities has never been greater.